Welcome to my YouTube channel. In this video we will talk about irregular periods. Before going to the video, make sure you hit the like, share and subscribe button. Irregular periods aren't always a sign of a problem. We break down what you should know about how to identify irregular periods, what causes them and when to see a doctor. Why is my period late? Graphic of 3 circles crossed out. Amenorrhea. Not having any periods for at least 3 menstrual cycles. Graphic of a 36-day timeline. Oligomenorrhea. Having periods more than 35 days apart. Graphic of an 8-day timeline. Menorrhagia. Heavy bleeding that lasts more than a week. During a normal menstrual cycle, an egg is released from one of your ovaries during ovulation. If the egg is not fertilized by a sperm, then changing hormone levels send your body a signal to shed the blood and tissues that line your uterus. This bleeding typically lasts about 5 days. Then, the monthly cycle repeats itself. But some women have what is called abnormal uterine bleeding, another term for irregular periods, which can happen for a variety of reasons, from stress and lifestyle factors, to more serious underlying medical conditions. What is an irregular period? An irregular period is when the length of your menstrual cycle unexpectedly falls outside of your regular range. Irregular periods can include abnormal uterine bleeding, such as bleeding or spotting between periods, bleeding after sexual intercourse, heavy bleeding during your period, menstrual bleeding that lasts longer than normal, bleeding after you've reached menopause. After puberty, many women have a regular menstrual cycle. However, it's normal for the cycle to vary by a few days each time. According to the American Academy of Family Physicians, AAFP, between 9 and 14% of women have irregular periods between their first period and menopause. Reasons for a late period, missed period or irregular period. There are a number of reasons why you may have an irregular, missed or late period, ranging from stress to more serious medical conditions. Common causes of irregular periods include uncontrolled diabetes. If you have uncontrolled diabetes, you may have irregular periods because the interaction between your blood sugar levels and hormones can disrupt your menstrual cycle. Eating disorders. If you have an eating disorder, such as anorexia or bulimia, you may have irregular or missed periods. This is because your body is not producing and circulating enough hormones to control your menstrual cycle. Hyperprolactinemia. Women who have too much of a protein hormone called prolactin in their blood can have irregular periods. Medications. Certain medications, including anti-epileptics and antipsychotics, can cause irregular periods. Polycystic ovary syndrome, PCOS, is caused by imbalanced sex hormones, which can disrupt regular menstruation. Premature ovarian failure. The ovaries of women with POF stop working before the age of 40. According to the National Institutes of Health. However, some women with this condition continue to have occasional periods. Stress. Stress hormones can affect menstruation, and prolonged stress can cause your period to be delayed or for you to skip it entirely. Also, when you first begin menstruating, it may take some time before your period becomes regular. Your period may become irregular up to 8 years before menopause. What to do when periods are late? If you experience any of the following symptoms, it may be time to talk to your doctor. You haven't had a period for 90 days. Your period suddenly becomes irregular. You have a period more often than every 21 days. You have a period less often than every 35 days. Your period lasts for more than a week. Your period becomes unusually heavy. You bleed between periods. Your periods are extremely painful. Thanks for watching. Now don't forget to hit the like, share and subscribe button.